what I'd like to do is go ahead and many of you know our guest speaker, but I will turn the time over to you, Stephen, to jump right into our presentation today. Um, Looking forward to the opportunity to learn from you as always. So, Stephen, with that, I'll give you mouse control and the stage is yours. Thank you.
Okay, thank you. Yeah, hey, sounds like you might need this a little bit yourself.
I know. Well, I kind of choked on my own. I was
Yeah,
talking and I kind of was like, oh.
yeah,
But yeah, I do. Respiratory health, especially in the spring, can be a
yeah.
challenge for me,
Well, that's
Stephen.
one of the reasons why I picked this topic. A lot of people have respiratory problems in the spring, in the winter and spring, and so we're going to talk about a little bit about the respiratory system first, and understand a little bit about the anatomy and physiology of it. Obviously, you have your sinus cavities and so forth, which the purpose of the sinus cavities actually is to warm and moisten and perform a little filtration on the air that you breathe. So when your sinuses are plugged and you have to breathe through your mouth, you notice how dry your mouth gets because um, it's sucking all the moisture out of your mouth, and so your sinuses have this kind of humid um, area to kind of make the air more moist going into your sinuses. Well, they have a lot of little hairs to capture dust and particles and everything to keep them out of your lungs. And then as the trachea comes off of the esophagus in the back of your throat um, and goes down into your lungs, into the bronchioles, uh, it gets into a little smaller and smaller thing until you have these little air sacs called alveoli. And that's where the exchange of oxygen and carbon dioxide takes place. Now, since there's always dust and viruses and bacteria and mold and yeast and other things in the air we breathe is never sterile. It's not meant to be. The mucous membranes that line the sinuses and the bronchial passages create mucus, which is why they're called mucous membranes. And mucus is a thin, watery substance. I think it's 97% water. Has a little bit of a protein matrix, sort of like the gelatin in Jello is a protein, and it causes water to congeal and thicken. So you have a little bit of protein in there that kind of gives a little bit of a thickness. And then there's antibodies in there and other things to protect against infection and so forth. And that mucus traps all that stuff, all of the microbes and dust particles and pollen and everything hit the mucus rather than actually hitting the surface of the cells. And then the surface cells also have these little hair-like projections called cilia that sweep the mucus. In the case of the mucus in your lungs, they sweep it up your bronchial passages until you swallow it. You clear your throat and swallow that mucus. And the same thing happens with the mucus from your sinuses. It's swept to the back of the throat, where it goes down the back of your throat and goes into your stomach, where it's digested and eliminated from the body. So breathing, of course, is the process of inhaling and exhaling to suck the air in to get oxygen and so forth. And it's supposed to happen primarily from the diaphragm, which is a muscle that separates your chest cavity from your abdominal cavity. And the diaphragm is supposed to pull down so that it inflates the lungs like a bellows, and then it contracts back up to let the air deflate the lungs, like letting the air out of a balloon, because there's elasticity in the little alveoli. So when the air is sucked in, they kind of swell up like a balloon, and then the elasticity basically allows, as you exhale, the air to flow out. There's a little bit of movement in the chest and ribs, but the primary way you're inflating the lungs is from the diaphragm. Now, these are some of the things that can go wrong, and we just want to kind of look at these really quickly. Rhinitis is inflammation of the eyes, nose, and throat, and this typically happens in response to some kind of irritation that takes place, such as it could be a mechanical irritation like dust, or some chemical that is in the air that is irritating those sensitive membranes in your eyes, nose, and throat. Allergic rhinitis is an inflammatory process that's caused because of a hyperreaction to something that is normally a benign substance. It's not normally irritating to the body, like a little bit of dust or pollen or so forth. Sinusitis is inflammation of the sinuses themselves, which usually happens because they're not cleaning themselves out properly, and the mucus is getting stuck up there, and it becomes a breeding ground for microbes. And most sinusitis is actually not viral or bacterial, although it can be bacterial. It's often fungal in nature, and so antibiotics don't necessarily deal with it. So, well, when you have chronic inflammation of your sinuses, there's usually some degree of a little infection up there, and the sinuses aren't clearing themselves out very effectively. Bronchitis, of course, is inflammation of the bronchial passages coming down into the lungs. So you see, all of this is basically something is irritating these tissues, and they're becoming inflamed. Now, those are the more acute conditions, although some of them can go chronic. Where you get into the real serious conditions is when you get asthma, emphysema, and COPD. In fact, chronic asthma is considered part of COPD. COPD is a phrase that refers to any kind of chronic disorder that's obstructing the air passages, which could be chronic bronchitis, chronic asthma, or emphysema, which is actually where the lungs get so badly damaged, the little air sacs start to lose their elasticity and start to break down, which makes breathing very difficult and results in wheezing. Asthma, of course, results in a constriction of the airways, and it has two things that are going on. One can be an excessive amount of mucus, which also tends to happen in bronchitis, as the body's trying to clear out the irritation. And the other one is a constriction of the muscles in the bronchioles. There are muscles in the bronchial passages that allow the bronchial passages to open up to let in more air, or close down to let in less air. So what's causing the damage? One of the things that I try to explain to people in natural healing is we don't just look and say, oh, there's inflammation, let's give an anti-inflammatory, something to get rid of the inflammation. We look at, say, what's irritating it? Why are the passages becoming irritated? Why is the mucus thickening or whatever? And it's usually because you're inhaling some kind of airborne irritant. Obviously, smoking is one of the worst, but there are a lot of volatile organic chemicals that are present in our homes and offices now that can be very irritating to people. Like, I knew two women who actually had respiratory problems because they cleaned homes professionally, and they were using commercial cleaning products that had a lot of chemicals in it. And both of them, their respiratory problems got better when they switched to natural substances that didn't have irritating things in them. Of course, there's also the natural things of like dust and pollen and so forth. And I'm going to talk a little bit about that where I live, because in southern Utah, where I live, the soil is a very fine clay soil. And in the summer when it's hot, there's a lot of dust, and that was actually for a while causing me to have respiratory problems. Of course, there's always viruses and bacteria and yeast and mold and everything present in the air. And that, of course, can get in the lungs. And if the body can't sweep it out and can't defend against it, then it becomes a problem. It's not because they're there, because they're always there, unless you suddenly inhale a whole large number of them. But otherwise, the normal levels of them, it isn't a problem, because the body has immune defenses on the mucous membranes that fight them off, and the mucus system to flush them out. Now, one of the things that start causing all of the above to basically have problems is dehydration. Since mucus is 97% water, as soon as you start to become a little bit dehydrated, the mucus starts to thicken and congeal, and it becomes very difficult for the cilia to move it, which then makes it difficult for the body to remove irritating substances from the sinuses and lungs, thereby causing those substances to remain in contact with the tissues and cause an inflammatory reaction. Now, this also happens, and this is where the more allergic part of it comes in, is that the mucous membranes of the respiratory system and the mucous membranes of the digestive system, if there's a lot of inflammatory process going on in your digestive system, then it triggers a hyperinflammatory response in the mucous membranes of your respiratory system. It's like that whole line of defense goes on hyper alert, and therefore the fact that you're getting a lot of irritation in your gut means you also now are more hypersensitive to irritants in your respiratory passages, and the two are linked. Now, in traditional systems medicine, it's also believed that an excessive grief and sadness would also damage the lungs of the respiratory passages. That is probably due a lot to its impact on the diaphragm and your ability to breathe freely. So as I said, mucus is that little secretion, and it's made up of primarily of water with glycoproteins, which are proteins with sugar molecules attached to them that make it thick. It's got a little bit of salt in it. There's minerals in it, but the primary one is the salt, just like it's in your blood. When you sweat, you lose water and salt. Mucus also clears water and salt. So that'll come up important. There are antiseptic enzymes, immunoglobulins, and proteins in there. In other words, there's immune enhancing stuff in your mucus to basically bind and neutralize critters and so forth, which is all part of what is your body's first line of defense, is your skin and mucous membranes. It's a protective barrier that is supposed to prevent things that are irritating and bad for you from ever getting into the body in the first place, just because it's a physical border. So the mucus lining is a protective coating, and that is what is basically allowing your respiratory system to protect itself against all of the environmental influences that it's exposed to by breathing in air. Now, the mucus and the condition of the mucus, therefore, is important to the health of the respiratory system, also to the health of the digestive system. And one of the ways that you can read the mucus is by looking at the tongue, because the tongue is a very good indicator, being part of the mucous membrane system itself, to what's going on in the mucous membranes in the respiratory and digestive system passages. So normal mucus is actually fairly clear. It doesn't have a lot of color to it. It's very thin, very watery. It's just that little bit of glistening coating on that tongue. You can see how it kind of shines just a little bit. That's mucus, a little bit of dampness on there. And when you first get exposed to an irritant, then the body starts making more mucus. And and that mucus tends to be very thin and watery. If you've ever noticed when you're just starting to get a cold, or maybe you just inhaled something that was irritating and all of a sudden you get a drippy nose. Well, that is this extra mucus being formed that's like washing the surface of those membranes clean. It's a defensive mechanism trying to flush off whatever the irritant is. It's not a disease. We have a confusion in our culture thinking that some of the things that are actually the body's defensive mechanisms are diseases, and they're not. They're actually normal function. That's what should happen. Now, when you start to become dehydrated and the irritants are basically starting to get the upper hand, then the mucus starts to become cloudy or gets a little bit of a white color. And that is a sign that the mucus is getting thicker, it's congealing, and that is a lot due to a lack of moisture that's taking place. And therefore, it's harder to move the irritants out. This is one of the reasons why that old adage that's been around forever and ever, that when you get sick, rest in bed and drink a lot of fluids, because your body cannot flush the things it's trying to flush if you don't have enough water. It starts to dehydrate. Now, once the mucus gets really thick, then you basically can get a mucus that becomes hardened and very difficult to move out because it comes completely dehydrated. We call that boogers or whatever. Or you can start to get your mucous membranes being very dehydrated and dry, which will result in like a dry hacking cough. Now the color also, as we alluded to the color, but the first sign you're becoming congested is white mucus. So if you look at your tongue and there's a lot of white coating on it, you're a little bit congested. It's that simple. Your lymphatic system and your mucous membranes don't have enough water to keep things moving really well. And so the traditional way that's dealt with, the TCM, it's called cold phlegm, is to basically drink a bunch of liquids and take some stuff that increases mucus production to get that thing flushing properly again. Now, yellow, when the mucus starts to go yellow, that's a sign that now you've got an infectious thing going on there. They call that hot phlegm in TCM. And that is usually a viral infection. So in other words, there's some kind of virus or whatever that's the body's fighting off. And it is the immune reactions that are basically causing the mucus to get a little bit yellow. Now, when it becomes green, then that greenish color comes from neutrophils, which are a white blood cell, which contain a greenish colored enzyme. By the way, pus in a wound is also neutrophils. So if you get an infected wound, you got pus, right? The green mucus is the same thing. It's like pus formation, meaning there's an active infection going on that the body is actually trying to fight off, and that is often bacterial. There could be a fungal component to either of those two. If there's red, then there's some kind of bleeding in the respiratory passages. If you're coughing up red blood, that's something to be, red mucus, that's something to be concerned about, because there's actually bleeding in your lungs. If you're blowing it out of your sinuses, it's like the bloody nose. So, all right, so here in the respiratory allergy reaction, which is what a lot of people are experiencing in the spring, right? You get these airborne pollutants that come in here. They go into the bronchial passages, and there are these cells, these white blood cells that are, called mast cells. They're all along here that are basically, part of your police force guarding the border of your lungs. And when those mast cells at a certain point recognize that there is an invasion taking place that is not getting flushed away, and those irritants are starting to get through the membranes, they basically release histamine, and histamine draws water into the area and to create more mucus. It initiates an inflammatory reaction, and inflammation is always there to sequester an area where there's damage or irritation to try to stop it from spreading, while the immune system gains the upper hand against it. And also at the same time that the inflammation causes swelling. And of course, if your bronchial passages are swelling and you're getting a lot of mucus there, then it's going to be harder to breathe, because the swollen tissue in the bronchial passages makes the airway smaller, and the mucus also congests the airway, making it much more difficult to breathe. And you've all experienced that in your sinuses. When your nose gets plugged up, the tissues of your sinuses are now inflamed, they've swollen, and there may be some congealed mucus up in there, and there's not enough space to get air through. And that same thing happens in your lungs, which is what gives rise to things like bronchitis and asthma. So in Dr. Batman Gila, who wrote Your Body's Many Cries for Water, also wrote a book called The ABCs of Asthma, Allergies, and Lupus. And his theory is that histamine is, which is involved in inflammatory responses, and is also a neurotransmitter in the nervous system, that it is created to pull water to an area where there is a problem, to basically help with the flushing of the irritants or so forth. And he maintains that when you're dehydrated, the level of histamine, the background level of histamine in your body, rises. And by the way, the histamine thing is also affects both the gut and the respiratory passages. which I learned that when you have like an allergy, or an allergic reaction in your sinuses, for example, and there's a lot of histamine then being pulled into the mucus, when you swallow that, it'll upset your stomach because it'll start creating an inflammatory process in your stomach. So you can get a respiratory allergy from pollen, and you'll also get an upset digestive tract in the process. Histamine suppresses antibody production, though, it then lowers the immune defense. So what he said, and this was interesting, that water and salt act as a natural antihistamine. In other words, if you drink a lot of water and you add a little bit of natural salt, which, remember, there's salt in the mucus, then that allows the body to hydrate the mucus, thereby allowing enough water to come in to start enabling the body to successfully flush the nutrients, which lowers the need for histamine and actually starts getting you better. Well, when I read this, I thought, well, that's an answer to what's happening to me, because I moved down to southern Utah and I love to work outdoors, but I'd go out and I'd work in my garden and I'd get a little bit of dust coming up into my eyes and my nose and everything. And that night I'd have this horrible rhinitis start to develop. I've always had sensitive sinuses because I had a lot of respiratory problems when I was young. And then my stomach would start getting upset too, and I wouldn't want to eat and so forth. I knew vitamin C was a natural antihistamine because it stabilizes mast cells and helps reduce the inflammatory reactions. And I was using that, but it wasn't quite enough. And so what I did is I started, when that would happen, I would start to take salt and water and just drink lots of water and add a little bit of natural salt to it. When I say natural salt, I'm talking about a salt that has color, like the real salt, the Redmond salt here from Redmond, Utah, or the Himalayan pink salt, or the Celtic salt, or any of these salts have a little bit of color because they've got all the minerals in seawater. And that would flush this off. And I realized I'm in a very hot, dry climate, and my mucous membranes are drying out. I'm not drinking enough. Now, when I work outside, I actually come in like every, probably almost hour and a half when it's out there in that dry air. And I literally drink a quart of liquid. I'll put a little bit of the antioxidant juice drink in there, maybe a little bit of lemon too, or a little vitamin C, but I'll drink literally a quart of this stuff, then go outside, and I haven't had a lot of problems since. Now, one of the other things that happens with people with breathing is a hiatal hernia, and this happens largely due to stress. So what you have is there's an opening through the diaphragm that allows the esophagus to come down into the stomach, and there's also some nerves that come through that opening. Well, what happens at hiatal hernia is the stomach moves into that opening. This gets too relaxed. Stomach moves into that opening, and there's a valve at the top of the stomach. Well, when that valve at the top of the stomach is shoved up through the diaphragm, it doesn't work very well, which results in acid reflux. And also, it makes it difficult to get a full abdominal breath. And I've never seen an asthmatic that doesn't have a hiatal hernia. I'm pretty sure that nearly everybody with COPD or any kind of chronic breathing problem has one of these. And if any of you look up on YouTube, hiatal hernia, Stephen Horne, there's some videos I did that explain how to identify that and how to correct it. And that's one of the big things I found that helps a lot of people. Now, as I mentioned, there's a connection between the mucous membranes lining the digestive tract and the mucous membranes lining the lungs. And both of them are associated with the Chinese metal element, which is the defensive element of the body, or what they call the metal qi, or the defensive qi. And the defensive qi flushes irritants or pushes irritants away from the thing. So like I said, if you've got chronic sinus problems or chronic respiratory problems, and this was true for me growing up with chronic sinusitis, But I've also seen it true for people with asthma and other chronic problems. They practically, I will almost guarantee that they have digestive issues. They need to do, they may need enzymes to help improve their ability to break down food. They may need to do some colon cleansing, tone up their gut or whatever. And that's really the ultimate answer. So one of the things that you want to consider doing when you have these chronic problems is start with a good cleanse. If your sinus and respiratory stuff also gets better if you do a short fast, like if you fast either 24 hours on just water or maybe a little longer with a little bit of fresh juice or something for several days, maybe eliminate some foods that may be hypersensitive to allergy, like wheat and dairy, and you notice that improves your sinus and respiratory stuff, then your digestion and food allergies may be actually causing your respiratory allergies, because basically you're heightening the level of histamine and immune reactions in the body, which is therefore making everything more sensitive. As I mentioned, it's not uncommon to see people develop respiratory problems after a significant loss. I've seen many people who after loss of loved ones actually started developing coughs and difficulty breathing and so forth. And it clears up when you help them go through the grieving process, which involves being able to cry. And there is a nice flower essence blend available that you can use to help with people with the grieving process that contains, I think, the core flower essence in it is Mariposa lily. So let's look at some of the actual things that are going to be helpful here. And I want to start off by saying one of the things that puzzled me when I was first learning about herbs is back then we had these books and they would list a bunch of ailments. And then there's, of course, this long list of herbs that have been used to treat that ailment. And basically it was all like, there was no explanation like I'm giving you as to understand what remedies are doing or why they're doing them. Just here are herbs that have been used for coughs. And there would be all different kinds of herbs on that list. There was different mucilaginous herbs, aromatic herbs, different kinds of things. And there was no differentiation of why you would use one herb or another. And so my results that I would get when trying to figure out what to use would be very hit or miss, because I didn't understand what I was trying to do. I was just trying to, link, here's a disease, here's an herb. When I got into this and I started to understand body processes, then I started to understand herbs don't treat diseases. Herbs support the natural process of the body that the body is trying to go through to heal. So instead of trying to figure out how to use something to suppress the cough or dry up the runny nose or whatever, I would figure out how to use something to help the body do what it was trying to do, which is flush off the irritation. There's a big difference between what I call allopathic herbalism and real natural health. Now, here are some of the things that can be helpful for reducing allergic reactions. I mentioned salt and water. That's the first one, okay? Also, vitamin C acts as a natural antihistamine and helps prevent histamine formation and also aids in the breakdown of histamine. So it calms down the whole allergic reaction. Quercetin is a flavonoid that basically makes the mast cells more stable and less prone to hyperreact to things. Bromelain is a protein digesting enzyme that has been shown to help reduce inflammation and swelling and is helpful in a number of instances, not just allergies. One of my favorite herbs for this is stinging nettles, which interestingly enough contains small amounts of histamine, formic acid, and some other substances that cause allergic reaction, yet taken internally appear to be like the hair of the dog that bit you, to actually calm down allergic reactions. And so those are some great herbs, and there's a nice formula that you can get that actually contains all of those things. Now, decongestant and expectorant herbs, There are basically, I'd say, two ways that herbs are helping with this process. One is the decongestants, in particular, herbs that are basically doing like the salt and water. They're helping to cause an increased flow of moisture to help basically make the mucus more thin and hydrated and loosen it up so that things can move. I mean, that's basically diverting water to help the move the mucus and hydrate it. The expectorants, on the other hand, are basically some things that are exciting the cilia so that they actually help more effectively move the mucus and flush it out of the body. So when you're using these herbs, you're not trying to get rid of the cough. You're not trying to get rid of the sneezing. You're not trying to make the symptoms go away. You're actually trying to make the cough productive. You're trying to make the sneezing productive. You're trying to make the runny nose productive so that you're actually helping the body do what it's trying to do, which is flush the irritants off of the respiratory members. This is one of the most important things I ever learned in natural healing, was when I started to understand how you used herbs to help the body do what it was trying to do instead of trying to make it the body stop. And all of your traditional, your medical herb remedies tend to do the opposite. They actually are tending to like try to dry up the mucous membranes. So the pungent and aromatic herbs are what TCM uses for cold phlegm. In other words, there's a lot of excessive white mucus, and they've also been traditionally used for colds and things in the West. And if you think about when you take spicy foods, they typically make your nose run a little bit or make you cough up some mucus. And so basically they're doing two things. One is they actually push water, blood flow to the surface of the skin and mucous membranes, which increases the amount of moisture reaching that to hydrate the mucus, as well as they are stimulating, so that they actually are helping to stimulate the movement of the cilia to expel it. And these include garlic, which is a really, really good herb for the lungs, for getting the fluid mucus out of the lungs. Horseradish, which is actually one of the best for getting it out of the sinuses. If you ever had horseradish or wasabi and gotten a little bit of the back of your throat and seen how it went up to your sinuses and boom, that's it. Capsicum, moderately useful for both. Fenugreek and thyme are particularly helpful for this in the sinuses, as are pine and eucalyptus. And that also includes the essential oils, pine and eucalyptus, which you can inhale, that help to do the same thing. Now, the bitters, okay, particularly herbs containing berberine, such as golden seal, Oregon grape, and barberry, have been traditionally used when the mucus starts to get discolored, indicating that there is infection present. So you're taking something to enhance the immune system to help fight the infection. So that's when these herbs get more helpful. I remember when I was first trying to use herbs, and the big popular thing was golden seal and echinacea. And I found that golden seal and echinacea, like especially taken at the beginning stages of cold, when the mucus was really thin and watery, didn't seem to help as much. But I've learned that they do help a lot when the mucus starts to get thicker. When the mucus starts to get yellowish and discolored, that's because that's an indication the immune system is having to fight an infection. Now, one other respiratory bitter is bitter orange, which bitters also have a drying effect. But they do tend to stimulate a flushing of irritants. But bitter orange also contains a little bit of something called synephrine, which is natural antihistamine. So it kind of helps to counteract the histamine response and help to dry up things as well. Now, when your lungs start to get really dry, and you've got a really hacking cough, a dry cough, when you're coughing and nothing's coming up, then there's irritants there, but there's not enough thin, watery mucus, or the cilia have been paralyzed. And by the way, what are they called? The opioid narcotics that they often give people for painkillers after surgery, whatever, have an effect of paralyzing intestinal peristalsis and also the cilia, so they don't move, which means people often get congested taking those drugs, and their digestive tract gets really sluggish. So sometimes you need to stimulate the cilia in those cases, but often you need to hydrate the lungs. And mucilaginous herbs are used when the lungs get dry and irritated, and the mucus is very dried out and is not moving very well. And again, you've got to take them with plenty of water, but the best remedies here are marshmallow, slippery elm, fenugreek, fritillary bulb. Those are all very, very helpful for when you have really dry mucous membranes. Another one that I should have listed here is mullein, but I think I listed it under salty herbs, so that will come in that. What I'm trying to do is, these are different kinds of herbs, and I'm just trying to show you that the kind of herbs you pick depending on looking at what's going on and figuring what you need. Astringents reduce excessive discharge. So if you've got really, really copious watery drainage and you need to kind of like slow it down, or if there's pink in the red in the phlegm, or the tendency to nosebleeds, you want to use an astringent to tone up the tissues and reduce the secretion. And a really good one is bayberry, because it doesn't over dry the tissues, and yerba santo, because it's an expectorant and decongestant, but also a little bit astringent. So but again, it does it without overly drying the mucous membranes. Now, here's the mullein. Okay, so salty herbs, which are herbs that have a lot of mineral salts, are also really good for hydrating the lungs when things are drying out. Now, remember, if you're dehydrated, this means that they're pulling water from other parts of your body to hydrate your lungs, and that's going to make you have problems elsewhere. So you always want to take these herbs with lots and lots of water, because part of the way they're working is by moving water. So mullein is one of the very best herbs when you've got like chronic respiratory problems, for slowly hydrating and helping the lungs to heal. You can take considerable large doses of it, like 6 or 8 capsules a day, for a period of several months, because it's a very, very mild, nourishing herb, and it will really help to heal and hydrate and moisten the lungs. Another one that most people don't know about is red clover will also do this, and has been traditionally used for dry coughs and so forth as well. And the red clover is particularly helpful if you're getting swollen lymph nodes in the process. There are also some sweet tonics, and these are herbs that also will moisten, but have a lot of capacity to help balance out the immune system, reduce chronic irritation in the respiratory passages, and also just really help when a person tends to have a lot of chronic respiratory weakness. One of my favorite here is cordyceps, which is actually a fungus. It's pictured actually growing on the right there. Cordyceps is a really good lung tonic for strengthening the lungs when they've become very weak, and it's also hydrating to the lungs. And it's also modulating to the immune system, so it actually helps the immune system to react properly and not hyperreact. Licorice root is one of the traditional remedies, along with marshmallow and mullein and so forth, for getting the lungs to hydrate. It's also reduces inflammation. So if you've got a dry, hacking, irritated cough, taking licorice root with lots of water will be helpful. And another one is astragalus, which is a remedy used in China to ward off wintertime colds and flu. And one of the things about astragalus, it works really well in where there's cold, dry air. So if you live in a climate where it gets really cold in the winter, but it's also very dry, then your lungs get dry and they get cold and they get damaged. And the astragalus is a little bit warming to the lung tissue, as in other words, it helps to get the circulation going, but it's also moistening, it hydrates. And therefore it helps to keep your mucus flowing good in the winter. So these are all really good remedies, again, to use when you're on the more dry side of the cough. There's also acrid herbs, the lobelia, black coash, and an herb called balloon flower or platycodon, which is in some Chinese herb formulas, that basically relax the bronchioles. So remember, one of the things that can happen in asthma, also it can also happen in COPD and bronchitis, is you start to get a tensing. The muscles are maybe swollen a little bit, and so the air passages are constricted. By relaxing the bronchioles, that is opening up the air passages to allow more air in, that can be very helpful. The herb I've used the most this way is lobelia. I've seen lobelia given in very small, frequently repeated doses, like 10 to 15 drops every 2 or 3 minutes, basically stop an asthma attack and help the person actually their lungs to relax, bronchioles relax enough to be able to breathe. So it's a really useful herb for me in a first aid kit. So we're going to open this up for questions here. I just want to mention the where I got this information in this presentation is I've got some Oriental Materia Medicas, information on Ayurvedic herbs in a book by my friend K.P. Khalsa, Kartapurka Singh Khalsa, and Michael Tierra. Also, I mentioned the Asthma, Allergies, and Lupus by Dr. Batman Gila, Encyclopedia of Natural Medicine, and I also have a database where I've collected information on different herbs and remedies. So we are now to the Q&A session. And so someone says, so the key to good respiratory health is water, and a little natural salt from time to time. Well, that is particularly true if you're living anywhere where the air is dry or when your body's trying to flush an irritant, okay? Because the main reason why you don't get over it really quickly is because the body's trying to flush the irritation, and then you take something to dry up the secretions, or you don't continue to drink enough fluids to allow the body to continue the flushing process. The mucus thickens, and now the body's having a hard time expelling what's irritating the lungs and sinuses, and that actually just makes it take longer to get well from the problem. So, like I said, some of the herbs that you can use, along with this, to basically help that process, because as the decongestants are also going to act like the salt and help to hydrate the mucous membranes. And your more spicy stuff, if you need to get it moving because it's stuck, you can use some of the more spicy stuff to stimulate that. It's the leaves that actually have the anti-allergenic behavior. The root is used actually for the prostate problems. You can make any of this into teas for people who won't take pills. You actually can take pretty much any formula, open up 3 or 4 capsules, and pour, a cup of hot water over it and turn it into a tea if someone can't take pills. And another way to do it for people who can't take pills is you dump the powders out and you mix them in something that helps to mask the taste so that they can just take it orally. Some things will mix okay in applesauce if they don't taste too bad, but you can also mix up herb powders in honey and then take the spoonful of the honey, where people can't swallow capsules, and the stuff doesn't make a very good tasting tea. There's a really nice, to get water into the cells, there's a really nice formula in the Chinese herb line that's for heat and dryness. And that formula I have found to be really good at getting the cells to hydrate better. When a person's really dry and thirsty and drinking a lot of water and it's going right through them, I found that formula to be very helpful. It's for heat and dryness. I think that the questions are not visible to all of the people. I don't know about how, if alkaline water gets better into the cells or not. And I assume you're going to post the presentation, handouts from the presentation, if they want to see the sources again. Brian, is that right?
Yes, sorry. We're gonna try to post this presentation, and I'll also move the. If you wait till the end of the presentation, I'll move the slides back to that particular slide as well.
Yeah. If someone's on oxygen, I'd have to know more about their general health. But what you want to do is you want to try to understand that you've got to look at the condition. That's why I started off saying, okay, look at the mucus, look at the tongue, to get an idea of what's going on. If the tongue is really, really dry, then the person needs hydration. If the tongue is really, really damp, then maybe they need something astringent to kind of reduce secretion. If it's is the tongue covered with a white coating or a yellow coating or whatever, that's what gives you the clues. The tongue is an insight into what's going on the mucous membranes of your GI tract and lungs. And that tells you, if you go back and review the presentation, that will tell you the kinds of herbs that you need to use. So then you could go look for the formulas that contain more of the kind of herbs that you want for the particular terrain you have, or you can add some single herbs in with the formula to make the formula more moistening or more drying or whatnot, depending on what the situation is. So rather than trying to say what she should do about the oxygen, I would say, look at the tongue. But her lungs dried out? What's going on? Is her digestion doing okay? You have to kind of look at the situation and then pick it. Someone says lobelia and water stops croup really fast. Yeah, it's also good for a spastic cough where you're getting tired from coughing so much. Local honey that contains pollen also desensitizes you to allergens in pollen. So if you can get local bee pollen or local honey that contains bee pollen that hasn't been cooked, that'll help to do the same thing that the nettles does. It calms down the hyperimmune reactions. A salty taste in the mouth all the time, you probably need to drink more water. What about during exercise? Some people need to use oxygen. Okay, if a person's needing to use oxygen, then their lungs are very weak, right? So what you would want is to use things that tonify or strengthen the lungs. And so you want something that builds up the metal qi, that along with cordyceps, for example, can really improve lung function. Yeah, and someone said is if the mucus is hard and plastic, it means you're dehydrated. Yeah, that's absolutely right. Or at least the mucous membranes are dehydrated. So if you're drinking enough water, but the water's not reaching the mucous membranes, then adding a little bit of salt or adding something that acts as a decongestant will move the water onto the mucous membranes to basically loosen the mucus and allow it to be expelled. One lady years ago wrote an article for me about her husband, her dad, who was in the hospital on oxygen, and she gave him chlorophyll, which enhanced the oxygen uptake in his blood. And she actually saw that because she could see the oxygen level in his blood on the monitor, and she would give him some chlorophyll, and the oxygen level in his blood would rise dramatically within a minute after taking the chlorophyll. But what she figured is his lungs were so chronically congested that she basically concentrated on hydrating and giving remedies that would break up the mucus. And eventually he coughed up a lot of dried, hard mucus and everything, and his lungs started to get better, and he started to be able to breathe better without the help of oxygen. So if you're, been really, badly congested, like as a person who's smoking is putting irritants into their lungs constantly, as well as drying out the mucous membranes in the lungs. Well, eventually the lungs can't clean themselves out very well. And then all those irritants begin a chronic inflammatory process that eventually starts breaking down the tissue of the lungs. And so I'm explaining how you think about things. We're so used to this idea of disease name, here's what you do. What I'm trying to do is explain how you understand what's going on, and then you try to find the remedies that are going to help support the body and what it needs to do to balance it. Yes, cracks in the tongue are a sign of dehydration. So definitely if someone has a cracked tongue and there's not much of a mucus coat on it, they're very dehydrated, and their mucous membranes in both their gastrointestinal tract and in their lungs are also very dehydrated, because again, the tongue is part of the mucous membrane system and a really good window to tell what's going on in the mucous membranes in both the lungs and the digestive tract.
I think, Stephen, we'll probably have to end there, end on that note, if you don't mind, on the questions and answers. So
I don't mind.
Thank you, everybody, for your questions, and thank you, everybody, for your participation. What a great opportunity we've had to learn about the respiratory system, and indeed we have. So thank you, Stephen. Excellent job. Appreciate you doing that presentation for us.